Hi guys, welcome back to my channel, Rumail here. So today, me and Faris.
Hello, I'm Faris.
We're going to be talking to you about the different type of interview questions, both from a medical point of view and also a dentist point of view. So yeah, I hope you find this video useful, and please subscribe to Faris's channel as well. Links will be all down below and somewhere here.
Check it down there.
And yeah, let's get straight to it.
Yeah, we'll see who's going to win today, but let's just say the dentists are obviously the better interviewees. So the most common type of question I get asked about is the ethical scenarios. So I thought I'm going to quiz Rumail on how he would go and approach them, and then we can compare it to what things I think are important when answering these types of questions. So go ahead, Rumail, take the board.
So when I approach like a ethical scenario, like throughout my interviews, like what I learned throughout and what I aimed for was, so let's say the interviewer is asking you about something to do with life support or something to do about who should get this over someone else. So in these type of questions, I think you just need to stick by yourself, because a lot of the time it's about what you think and how you portray it to the interviewer that actually counts, because many times they know there's no right and wrong answer. That's the biggest key here, no right and wrong answer. But at the same time, you need to make sure that you're getting your personal opinion across to the interviewer, because if you just get struck down by the question and you go completely blank out, you don't know what to say, or you don't feel confident in yourself, that's going to come across very negatively to the interviewer, and then unfortunately they will mark you down. But as long as, let's say, me and you might have a difference of opinion, so you might say euthanasia should be legalized, I might say it shouldn't be. But if I can give good cohesive points on why it should be legal or why it should be illegal, then mine and your case could be justified to the examiner. So it's not like we are trying to prove them wrong or agree with them. So, but the biggest key is just stick to what you think, and make sure, like, even interviewer will try and push you back and they'll try and counter you each time. You just need to make sure that you get your message across and stick by it.
Definitely, yeah, I definitely agree with that. The one thing I'd say though, guys, is you have to remember, as Rumail said, there is no right or wrong answer. People will go into these ethical scenarios thinking, I need to give the perfect answer, I really need to hit X, Y, Z, I need to say this, this and that. But most of the time, it's just understanding that, okay, here's the scenario in front of me, what are the two sides of it? So as Rumail said, let's say you have a question on euthanasia, you'll probably have to be debating, should euthanasia be legalised or not legalised? And based on that, what points can I make for each argument? Taking in your own personal view is important, but also make sure you don't bring in any biases. So don't try and weigh in one specific point over the other, because you have to make sure that it's more of a conclusive answer. You need to take into account all different things. And it can be quite difficult because sometimes the interviewers aren't the nicest. I'm pretty sure you've had the same scenario. And they'll give you a lot of pushback. They'll be like, what do you mean by this? And they'll really, really press into the statements you make. So don't be afraid. Everyone goes through it. Half the time you come out of the scenario thinking, like, I've completely messed this up. But it's fine, because that's what they're trying to do. They're trying to assess your ability to deal with a difficult situation.
Yeah.
It's not just about, I think euthanasia is right, I think euthanasia is wrong.
Because at the end of the day, everyone will have a different opinion.
Exactly.
Like me and Faris might have a different opinion, or me and any of you would have a different opinion. So
Definitely.
it's just about how you relay your opinion and how you put it in a nice, like, cohesive way to the interviewer, so then they can mark you appropriately.
Definitely. So the main points are, you need to make sure that you evaluate both sides of the question, and when you're interpreting it to the interviewer, you're very clear and concise with your points. You don't want to ramble on, because as I said, you're going to get a lot of pushback sometimes, so you need to make sure that you get straight to the point and you explain yourself very clearly.
So yeah, following on from ethical scenarios, now we're going to move on the typical question of why this uni, so why King's or why Birmingham, etc. So yeah, Faris, what's your take on that?
So this question's one of those a lot of people don't really prepare for. They just think, oh, I'll just work it out when I get there. But a lot of the time they can be quite, difficult questions to answer in the interview, because you need to take into account the location of your university, anything interesting around there, maybe the different societies that you'd be interested in joining. And nowadays there's no excuse to say, oh, I don't know, because just go on Instagram and type in like KCO any society and you're going to find it. So you really need to make sure that you read up in university when it comes to just like the social side. And on top of this, you also need to read up on like any research that you see, because I remember in one of my interviews I got asked, do you know about X research at this university? And I was like, to be honest, no, I don't. And it was a very awkward situation, and I kind of had to like just power through that station and forget it. But you don't want to be put in that same situation as I did. So just try and make sure you read up and find some information.
And one general tip, adding on to Faris's point, is that there will always be stations that you won't do as well in. So it's just about, and the beauty of MMI is that one station does not influence the next. So once you go into the next one, make sure you go in with a blank mind, and like it's like, or you can start all over again. That interviewer will not judge you based on the last one if it went terribly. And I reassure you, it probably went a lot better than you think. Like, you just need to just keep that self-confidence through, and hopefully it'll be all good at the end.
100%. Like, so many times you'll come out of your interviews and you think, there's no way they're going to give me an offer. I remember I came out of one of mine, I was just like, I just want to get out of here straight away. But I got an offer for the place, and even though I was surprised, it's because if you do enough practice, you naturally get used to the styles of questions you're going to be asked. Like watching videos like this or going over, different things online, different resources can really prepare you for these really difficult interviews. And you just shouldn't stress too much. Just make sure that you stay calm and collected, and most of the time it sort of falls into place. So yeah, cool, nice. So following on from that question, we're going to ask the infamous, very famous question of why medicine or why dentistry. So Rumail, take it away. What would you say if an interview asked you why you want to do medicine?
So yeah, this question, as you know, everyone has always tried to prepare for it, and everyone knows it's going to come up majority of the time. So for this question, I think the key is not to be cliche, because many people, as we all know, make the mistake or make the small it's like being naive basically. Because many personal statements I read, people will go like, I was 4, my mum brought me a stethoscope, and I like.
And now you're suddenly going to be the world's best doctor.
Sorry, but a stethoscope does not mean you'll be a good doctor. Yeah. So the big message from that is that you need to make sure that you've got a big passion for medicine, and you need to just relay that onto your interviewer. Like, please don't avoid being cliche, as I said, but at the same time, do tell them what you're passionate about, why you are passionate about it. Like, it's a very personal question. So I do get like some people will have very, very personal experiences, like someone had a surgery or someone in their family experiencing. Fair enough, but still on top of that, you need to make sure that you are relaying like your personal side of the story and not making it like another cliche statement that 10 students before you have just said. So you won't get that high mark you need to get selected. So yeah.
Exactly. Yeah, it's just like the reason why it's so difficult isn't because the actual question is hard. It's because it's very hard to be unique. And a lot of people go through, as Rumail said, like these like sob stories where they go through like really basic things that they think are unique to them, but it's just reproducible with every other candidate. And you need to make sure that you stand out. And as Rumail said, like very clearly, show your passion. That's the best thing I can say. Do your research. Like spend some time reading into why you want to do medicine or why you want to do dentistry. Like you really need to understand why you're going to dedicate like 5 or 6 years of your life to this one degree, which is then going to continue for the rest of your career.
Exactly.
Which is, you can't go in saying like, oh, it's because my mum bought me a stethoscope or I saw some teeth one day and I thought, you know what, let's do dentistry.
Like this decision is going to be with you for the rest of your life. Like when you're 50, 60, you look back at this and it's a very big decision. So you need to make sure in your full confidence it's the right decision you've made.
Exactly.
So you don't regret it down the line.
100%. Like, just think of it like that. I think, just remember, okay, whatever I'm saying here is just a representation of why I'm going to do this degree and why I want to, stick with this very rigorous course, because they're not easy. Like, it's not going to be a fun time all the time. You need to understand that these are going to be, it's not just like once you're a doctor, it's all going to be fine. No, it's continuous learning throughout your whole life. It's continuous understanding that there's everything that I've learned before can be changed in an instant. Any papers that come out, any like sort of innovation. It's a very rapidly changing career, and you always need to be ready to like improve your skill set. It's not like this. You've heard it, another cliche statement. It's a lifelong learning experience, but it actually is. Like once you like a lot of our parents, we've seen like even when they're like 30, 40, 45, they're still doing this exam, this extra module, this specialization. So it's a very long process and you need to be very dedicated to it to thrive. Yeah. And for you to show that dedication and like ability to thrive, that's why they ask the question, is because they're trying to see, okay, why are they crazy enough to do this like 5-6 year degree? So that's just our best advice, really. Just make sure that you're very like honest and clear with your passions and really show the interviewer that you care about this degree and you really want to follow through with it.
Yeah, and just be true to yourself, and I'm sure you'll excel at this question.
Yeah, definitely. Hey guys, so they're kind of like all the question types that we wanted to cover today. We're quickly going to go over what we think is going to happen in terms of the whole COVID situation. From what I've looked at online, it's looking like it's probably going to be online.
Yeah, I think Kings have said where we study that they're going to do it all online, so we'll have to see how it works, but it's everyone, I'm pretty sure majority of the medical schools, dental schools are going to work holistically on this together, as they've said. So yeah, I'm very sure it'll be online.
Definitely. Like it's mostly going to be online, and it's going to be a bit of a weirder experience. However, the one thing you need to bear in mind is it doesn't mean it's an excuse for you not to look professional. Yeah. Because a really key thing in the interview is, obviously the way you speak, being articulate, but also how you look, because those first impressions really last. You don't want to be coming across with like a scruffy look or like just like you just woke up and came showed up and frizzy hair everywhere. Make sure you're nice and tidy and you feel the best in yourself, and just that's all you need to do, and then I hope for the best. It's a new situation for everyone. Like, we wish we could tell you more, but our best advice is just listen to what we said, try and take those tips on board and apply them in this online version of an MMI or panel interview. And I'm sure you guys will be okay.
And
That's that.
Okay, thank you so much, guys, for watching this video. Thank you so much, Faris, for joining us on this interview style video we did on medical point of view and also the dentist point of view. So yeah, please follow Faris's channel as well. The link will be down there and in the description. And yeah, take care, stay safe, and we'll catch you in the next one.
Thank you guys for
Take
watching.
care.
See ya. Nice. Easy.
Easy, baby.